All right, so we finally made it through the Medicare AEP period, and the holidays and the festivities have subsided. Happy New Year's, by the way. But now it is January. The food comas have worn off, and you are not sure if there's anything that you need to do to your Medicare. So today we're going to talk about the 5 things you should do now that the AEP period for Medicare is over. At least if you want to ensure your 2025 goes smoothly for Medicare. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP, or really all year round, give us a call at the information down below, and we'll be happy to help them to make those tough Medicare choices. Also, don't forget to like and subscribe. AEP can be an exciting time. It's when the world seems to open up for folks looking at their Medicare options. Maybe your phone is ringing off the hook. Your mailbox is exploding with new, interesting, and enticing Medicare options, and maybe you're getting calls from the agent who you have not talked to for quite some time, asking if you need help renewing. And there are good reasons to check out those options, but in this case, you did. You made a change, you got a new plan, and it's January, and you got questions, and it seems like you have been abandoned. So let's talk about the 5 things that folks can do immediately after AEP to ensure they have a seamless 2025 Medicare year. First, and sort of the most obvious, but often overlooked, is to take a look at the welcome packet that you received in the mail from your Medicare health plan. And don't just stack it over there with the other ones you have unopened, because it will include all the changes to your plan, all your benefits, and something called an explanation of benefits, or EOB. Now, this is a thick document that will go into excruciating details about your plan, and much more in depth than you probably would have gotten from your plan booklet or the highlight sheet that you saw when you enrolled. Or if you did it online, it's available online, but they're usually pretty buried deep in the plan's website. They kind of don't present it up front. But it will tell you all the limitations and the exclusions on your plan, and they may have changed. Even if you're on the same plan, they may change for the next year. So that includes things like the copays and the types of things that are not covered. The things that you would normally think would be covered and maybe were covered under your work or a under 65 plan, but now they're not. Also, it makes for great lulling sleep material, if you're into that kind of thing. Either way, at least familiarizing yourself with the plan documents can be a big help. It might often jolt your memory of some of those extra benefits that people really liked when they enrolled, but then they forgot about because it's 3 months later, like things like how to register for your free gym membership, or which chiropractors you can utilize, or how to order things from one's over-the-counter catalog if they have one. Next up, and really super important, is to check your new healthcare card. Now, this may seem like being a bit extra, but here's the thing. Insurance companies, obviously, they are not perfect. And it is not uncommon for personal information on one's Medicare plan card to be incorrect. So that's why you want to make sure your information is correct, but also that the primary care physician that is listed on there is the one that you had chosen and is the preferred PCP that you want. This is one of those things that if it is incorrect, oftentimes people will not even find it out until they are sitting in the doctor's office and handing that card over. The problem with this is because most Medicare Advantage plans that folks enroll into are HMO plans, you cannot just go to see any doctor, even if that doctor takes Medicare overall. And in fact, you can only go to the primary care physician that you are selected and assigned to. So if there is an error and you were accidentally assigned to a different doctor, well then you can only go to that new assigned doctor. You can't go to the one that you actually specifically designated originally on your Medicare plan. Luckily, it is a pretty easy fix, but usually you can only change your doctor once a month. And that would mean rescheduling any appointments you already had for at least 1 month at best. Next up is one that will take a bit more work, and if you need help, you should definitely contact your agent or the carrier, the insurance carrier, but it is to fill out and register for all those great extra benefits that are available on MAPD plans, but oftentimes, and usually at times, go underutilized. Not because of lack of interest, but just because of the wonkiness that sometimes exists to have to get things registered and applied for. One of the biggest culprits of this is the gym memberships. Now, most plans, at least at this point here in Southern California, will have free gym membership options that will allow anyone enrolled in that plan to register and to go to pretty much almost all of the biggest gyms that are around, and even some of the small mom and pops ones. It is free, it is a great benefit, it keeps you healthy, but it does have to be registered for. But in addition to things like the gym membership, sometimes you may want to put in your over-the-counter catalog order, which can be done in person, it can be done online, or can be done over the phone. And this allows you to utilize those over-the-counter benefits and budgets that are available on many of the plans to get some of those daily necessities, things like toothpaste, Band-Aids, shoe insoles, the little mats that go in the bathtub. Also, sometimes the monthly benefits will roll over, allowing them to accumulate so you can get a bigger items, but many times they don't. It's gonna vary from one plan to the other. So if you don't use them, you end up losing them, and that just means more money out of somebody's pockets for things that they were going to buy anyways. For this next one, I think it's actually really important because it could save Medicare beneficiaries literally thousands of dollars a year in monthly premiums, in copays, and even in deductibles for things like their prescription drugs. But the one thing you would want to check directly after AEP is if you are eligible for a program called LIS, or the Low Income Subsidy Program. Oftentimes it comes out as extra help. You'll get a letter that says extra help. The LIS program is a program that is run by the federal government, and it helps folks with moderate income, not just low income, to cut their prescription drug costs. There are kind of multiple levels of eligibility based on one's income, and it can be enrolled into even by those folks whose incomes or assets are too high for other needs-based programs like Medicaid or Medi-Cal here in California. So you can make a little bit more money, not be eligible for those programs, but still get the savings from the LIS program. So why would you want to check this thing every single year? Well, because of the fact that the program is based on an income metric called the Federal Poverty Level, or the FPL. And every year, the applicable income will change. And by that, I mean that income bar goes higher and higher. So maybe in the previous years, you weren't eligible because you were above that bar. But as that bar continues to move up, well, now you might actually be eligible, and you don't really know what the new rates are unless you check. And we'll go much more into depth about the LIS program in some of the future videos. But yeah, it never, ever, ever hurts to check with your local Social Security office or your agent, and they can help you decide if the LIS program is something that might make sense for you to apply for so you can save lots of money on your medications. All right, so that brings us up to the last thing today that you should check right after the AEP period when your Medicare plan starts is to set up your annual checkup. Now, I know, you probably get a lot of this. I probably sound like a broken record, but the annual checkup is one of the best perks of getting a Medicare Advantage plan because it is included free, and it could be that 1 ounce of prevention that is worth literally the pound of the cure. Maybe even in this case, literally. Also, sometimes the wait for checkups can be quite long, so getting it scheduled as soon as possible means that you can get it done, get it out of the way, and you don't have to worry about it till the next year. So there you have it, just a couple of the great steps you can take as of the first of the year to get your health and your Medicare off on the right foot. But if you have questions about your Medicare options, feel free to reach out to us at the information down below, and we'll be happy to assist you over the phone or in person at one of our many Southern California offices in English or Spanish. And also don't forget to like and subscribe to get all of our great Medicare content that comes out every single week. So for Michael's Medicare, I'm Michael, hoping that you have a great rest of your day, and goodbye.